Hi, this is Magdi, your teacher for Anatomy and Physiology. This video, just like all of my other videos, is intended to be only for GCU students who are enrolled in one of my classes. Please do not share this video with any other student. Now we are going to continue with Lab 6, and this is the second part of the axial skeleton. We will start with the hyoid bone. So hyoid bone is just inferior to the mandible, and this bone is different from all other bones because it is not articulating with another bone. It's just floating around, is attached to different muscles that elevate and depress this bone, but is not articulating. There is no joint between this bone or any other bone. It has a body, it has a lesser horn and a greater horn, and that's all what I want you to know about the hyoid bone. It has a body and it has lesser and greater horns, or also called corneo. The second part is the thoracic cage. Now, thoracic cage, as we know, is made of different bones. So let's start with that. We have anteriorly the sternum. Posteriorly, we have the thoracic spine, and laterally, we have the ribs. The sternum is divided into three parts. The first part is called the manubrium sterni. The second part is the body, and the third part is the xiphoid process. Xiphoid process stays as cartilage until around the age of 40 when it ossifies and becomes bone, and that's why the xiphoid cartilage has the same color like the costal cartilages here. Between the manubrium sterni and the body, we have the sternal angle, which is a very important landmark. This is the point where you have the second rib articulates with the sternum. So it's also called the angle of Louis, and this is how it's most commonly called in medical practice. Then laterally we have the ribs. As we know, we have 12 pairs of ribs. The upper 7 are called true ribs. They're called true ribs because they have a costal cartilage, and as you guys know, costal means rib. So the costal cartilage of all these 7 articulates directly with the sternum. The other ribs are called false ribs because they either don't have costal cartilages like the last two, or that their costal cartilages attach to the rib that is superior to it. They do not attach directly to the sternum. So again, from 1 to 7, these are my true ribs. From 8 to 12, these are the false ribs. And then the last two, which is 11 and 12, these ones are called the floating ribs. Here is my sternum again. This is my manubrium sterni. This is the body of the sternum, and this is the xiphoid process. This is my sternal angle here, which is an angle between the manubrium sterni and body. So if you try to feel these on yourself, you will find that both the manubrium sterni and the body are at different planes. They are not at the same plane. There is an angle between them here laterally. There is also what's called the jugular notch, which is just above the manubrium sterni. And we have also the clavicular notch, where you have the clavicle articulates with the sternum. Now the manubrium, which, as we said, the superior section of the sternum. Then we have the body, which is the biggest part of the sternum. And lastly, we have the xiphoid process. We have also on the sternum, we have the jugular notch, which is the central indentation at the superior border of the sternum. We have the sternal angle, which is between the manubrium sterni and the body of the sternum. And we have the xiphi-sternal joint, which is between the xiphoid process and the body of the sternum. So again, here we have the ribs. So all ribs are attached to the vertebral column posteriorly, but some of these can attach to the sternum. So if we call these ones vertebrosternal ribs because they start at the vertebrae posteriorly and they attach to the sternum anteriorly. We have the false ribs, and these ones are called the vertebrochondral ribs because they start at the vertebrae posteriorly and then they go to the ribs anteriorly. And then the last two are called the floating ribs, and these are called the vertebral ribs because these ones attach only posteriorly to the vertebrae, but they attach to nothing anteriorly. And I want you to know these synonyms because it's important for exam purposes. So here is one of the ribs that we have. It has the head, and behind the head there is a constriction, and any constriction behind any head is called a neck. Then it has an angle and has a shaft. On the neck, or just posterior to the neck, you have an articular facet, and it's above on a tubercle, and the word tubercle basically means a small elevation above the surface of any bone. On the head, we have two articular surfaces. We call them articular facets. One of these articulate with the vertebra, and the other one articulates with the vertebra below. Then below the shaft here and at the angle, we have a space where the blood vessels that are between the ribs are hiding here from any trauma that might come to them. So they hide here in this secured place. So this place called the Costal Groove. Costal means ribs, and the groove is a depression that is elongated. And finally, towards the end of the rib here, we have a junction that articulates with the costal cartilage. So the costal cartilage will be an extension over here. Here is just a bigger picture that shows you the neck, the head. You have two articular facets, and we have the articular facet on the tubercle. This one also articulates with the vertebra, and we'll see the exact location of all these articular facets in a minute. Then this is my angle. This is the body, or the body also called the shaft, and this is my costal groove. This is just another picture that shows the body, the costal angle, the head, and the neck. Now here is the picture that shows the articulation of the ribs with the with the thoracic vertebrae. So this is a thoracic vertebra, and every vertebra is made of a body, and we have here two pedicles and two lamina, and then we have the spinous process, and we have transverse processes. We'll cover this again in more details in a second. But let's just see how the rib articulates with the thoracic vertebra. So this is the head of the rib. So part of the head of that rib will articulate with this thoracic vertebra with one articular facet, and the other part will articulate with the vertebra above. Okay? And at the same time, you have this articular facet on the rib tubercle will articulate with the transverse process of the thoracic vertebra. And we should see this picture one more time. So here is my thoracic vertebra. Here is the head articulating with the body, and here is the tubercle articulating with the transverse process of this thoracic vertebra. Now, we are done with the sternum, we're done with the ribs, so we'll go back now to cover the vertebral column. So vertebral column, as we know, is very important to carry the weight of the body and transmit that weight to the lower limbs so we can carry ourselves. It also surrounds and protects the spinal cord, and at the same time it provides attachments for muscles of the back and neck. These muscles are called anti-gravity muscles, and they are allowing us to stand erect. So this is my vertebral column, which is made of multiple vertebrae. So here is my cervical vertebrae, then we have thoracic vertebrae, we have lumbar, sacral, and the last are coccygeal. So the cervical vertebrae are 7, so we name them from C1, 2, 3, 4, 5, 6, and 7. Then the thoracic vertebrae are 12, so we give them T1 through 12. Then the lumbar are 5, we give them L1 through 5. Then we have 5 sacral, S1 through 5, and we have 4 coccygeal, which is CO1 through 5. So I want you to know the number of every level of vertebrae. This is very important. So we have 7, 12, 5, 5, 4. 7, 12, 5, 5, 4. Here's another picture with my cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, and coccyx. Here is a different view that we're looking from behind. So this is a posterior view of the cervical, thoracic, lumbar, and sacrum and coccyx at the end. So, and here's the way we number them. And why didn't we give a C for coccygeal vertebrae? Just because we give a C here for cervical, so we have to write CO to mean the coccygeal. We have curvatures for the spine. There are normal curvatures and abnormal curvatures. We'll talk first about the normal curvatures. We have a curvature that is posterior. So if you put your hand now behind your neck, you will see that your neck is concave posteriorly, and the same for your lumbar spine. While the thorax and the sacral spine, they are convex posteriorly, and they are concave, of course, anteriorly. The same here for the cervical and lumbar vertebrae. They are convex anteriorly and concave posteriorly. So let's go back and see one of these pictures to explain what I mean by convex and concave. So as you can see here, this is my cervical, and it's concave posteriorly. And this is my lumbar, and it's concave posteriorly. The sacral is convex posteriorly, and the same for the thoracic. If you look interiorly, then it's the opposite. I have convex here, concave here, convex here, and concave here. I hope this helps. If it does not, please let me know in the class. Now we'll move to talk about the general structures of vertebrae. So for every vertebra, we have a body that is characteristic for every level of vertebrae. So the lumbar vertebrae are going to be very different from the cervical vertebrae. So this is the body of the vertebra here. And then we have 2 pedicles. So those pedicles are attached to the body of vertebra. And we have 2 laminas. So here is lamina, and here's another lamina. And the 2 laminae and the 2 pedicles together, they make one complete circle. We call this circle the vertebral foramen. And make sure you know it's called vertebral foramen, because we'll have another foramen that has a similar name. Then from the junction between the lamina and the pedicle, we'll have the transverse process, and from the junction that is between the 2 laminae, we will have the spinous process. So these are the basic structures that make the vertebra. And also on every vertebrae, we'll have some articular facets. So for example, here we have the superior articular facet that will connect this vertebra with the one above. And if this was a thoracic vertebra, which is of course the case here, then you'll have also a facet on the transverse process on which the rib articulates, as we saw previously. Now here is again another picture of a vertebra, and this time it's a lumbar vertebra. You have the body of the vertebra. These are my pedicles. These are my laminae. This is the spinous process that projects posteriorly, and this is the transverse process that projects laterally. And I have here superior articular process that articulates with the vertebra above. Now, the general structure of vertebrae include body, vertebral arch, vertebral foramen, spinous processes, transverse processes, superior and inferior articular facet. In addition to that, we have the intervertebral foramina. So this one is between the two vertebrae. So the upper part of the intervertebral foramen is made by this vertebra, while the lower part is made by the vertebra below. In addition to that, between the two vertebrae, we have what's called intervertebral disc. If we start with the cervical vertebrae, we have 7 cervical vertebrae. They start small and they get bigger. C3 to C7, these are called typical cervical vertebrae. C7 has a specific name. We'll call it vertebra prominence because it's the most prominent vertebra. So here is one of the typical cervical vertebrae. As you can see, this is the body of the vertebra. This is the vertebral foramen. This is my spinous process. And these are my transverse processes. But here there is one extra foramen on each side. These ones are called the transverse foramina. And these transverse foramina, once you see them, you know that this is a cervical vertebra. Here is a side view of one of the cervical vertebrae. You can see here there is a spinous process, and here is a transverse process, and here is the vertebral body. Here is my transverse foramen that is in the transverse process. The spinous process typically is bifid or cut. This is what I'm trying to show you. The spine of the cervical vertebrae, they're all bifid, and the reason for that there is a ligament here that covers all these spinous processes except the C7. So this ligament is called the Nuchal Ligament. So the nuchal comes from the back of the neck and covers all the spinous processes except that one, C7. So if you try to put your hand behind your neck, try to go all the way down, it's going to be very difficult to feel any vertebra because all these vertebrae are covered by a thick, big, long ligament. It's called the Nuchal Ligament. And we will come at a certain point where you can feel the spinous process of one vertebra. This will be your C7. Okay. Now here is another picture that shows the bifid spines of all vertebrae except C7. Now we said C3 through C7, these ones are called typical cervical vertebrae. The reason that we call them typical because there are atypical. The atypical ones are C1 and C2. C1 is called Atlas, and this comes from the Greek myth that Atlas is carrying the earth. So that's how this vertebra, C1, is carrying the skull. So this Atlas does not have a body or spinous processes. And the joint between the atlas and the skull allows you to nod your head yes. So let's see this picture here. So here is my atlas. Well, this is different from the rest of the cervical vertebrae because it does not have a body at all. It has an anterior arch, it has a posterior arch, and the posterior arch, as you can see, is much more curved than the anterior arch. It has two lateral masses as well, but still, as you can see, it has the transverse foramina. Here is again my atlas, C1. I have two lateral masses, a posterior arch, an anterior arch, in addition to two transverse foramina on two transverse processes. But I do not have a spinous process posteriorly, but instead of that, I have a posterior tubercle and I have an anterior tubercle. The second one, C2, is my axis, and this one has an extra projection called the dens or the odontoid process. And the main function of this dens actually that it works as the body of the C1, as we will see. But let's first focus on the axis. So the axis has also transverse processes, but it has lamina here, and it has a spinous process, and it has body. So let's see how does this dens function. Here's my dens, here is my vertebral foramen, here are the laminae, and the spinous process. Now that's how the dens function. The dens acts as if it's the body of C1, so it projects up in order to substitute for the absence of the body of C1. So here is my atlas, here is my axis, and the joint between the atlas and axis allows you to shake your head no. Next one is my thoracic vertebrae. Thoracic vertebrae are very different because they have heart-shaped bodies, and they have also a spinous process that projects posteriorly and inferiorly. So let's see this one. So here is my thoracic spine. These are my thoracic vertebrae. As you can see, we start with smaller size, and as we go down, we increase the size of the vertebra. We also increase the height of the intervertebral discs and the size of it as well because we're carrying more weight. And as you can see, look at these spinous processes. These ones are projecting inferiorly and posteriorly. And you can also appreciate that it's more curved, concave anteriorly, and more convex posteriorly. Here is my thoracic vertebra, and as you can see, the body of the thoracic vertebra here is heart-shaped. We still have the vertebral foramen. We have also costal facets, and we know that these costal facets are only present on the thoracic vertebrae because the head of the ribs articulate here, while the tubercle of the rib articulate here on the transverse spine. And here's my post-spinous process. Here's a lateral view, which is very nice because it shows you how the inferior and posterior, the projection for the spinous process of the thoracic vertebra. You can appreciate here the upper half of the intervertebral foramen. Of course, the vertebra below will make the lower half of the intervertebral foramen, and the intervertebral disc in between will participate in the formation of this intervertebral foramen. Here is another view of the thoracic vertebra from behind. You can appreciate how the spine is pointing posteriorly. And also you can see that there is a superior articular facet of this vertebra that will articulate with the inferior articular facet of the vertebra above. Here is again the picture that we saw earlier. here is the head of the rib, and it articulates with the body of the vertebra and the one above it. And at the same time, as you can see, here is the tubercle that articulates with the transverse process of the thoracic vertebra. Next, we have the lumbar vertebrae. So the lumbar vertebrae, these ones are much bigger. Their transverse processes are shorter, and the posterior spinous processes are also shorter and more straight posteriorly. So as you can see here, here is my transverse process, is my spinous process. They are much shorter than thoracic, and they're also straight. They're not at an angle. Here is again this is my L1, 2, 3, 4, and L5. Here is a lumbar vertebra, and this is a superior view, as you can see. And you can also appreciate that the spine here is much shorter and more transverse. Here is a better view, that's lateral view, that shows the more flat and transverse spinous process that is not pointing inferiorly. That's what I meant by transverse, because there are transverse processes here that are also smaller and they're pointing laterally without an angle. Here is, for your information, some table that differentiate between both cervical, thoracic, and lumbar vertebrae. Next is my sacrum and coccyx, and these ones are very unique because both of them are fused. You don't have really a functional intervertebral disc that allows any movement here. The same for the coccyx, which is also from 3 to 5 vertebrae, but we can just say on average 4. This is my sacrum. This is all I want you to know, that this is the sacrum. I have here this side of the sacrum is called the ala of the sacrum, and these foramina are called the sacral foramina. This one allows the spinal nerves to travel outside from the foramina. This part here is very important in gynecology and obstetrics because this is called the Sacral Promontory. The reason for that is the pelvis is measured from here to the symphysis pubis. Then these are my coccyx. Here's a posterior view where I have the ala on the side again. I have also posterior sacral foramina. I have a coccyx here. And instead of having spinous process for each vertebra, we just have one very long fused median crest, and the word median means in the middle. Here is a sacral hiatus, which is very important for those who are interested in anesthesia, because through the sacral hiatus you can introduce epidural anesthesia. Now back to the normal curvature. We said we have thoracic and cervical curvatures, lumbar and sacral curvatures as well. So the thoracic and sacral curvatures, these ones you're born with them. So when you're born you have two curvatures, one in the thorax and one in the sacrum. That's why we call these primary curvatures, because you're born with them. Then you have the cervical and the lumbar curvatures, and these ones develop later on. We call them, that's why, secondary curvatures, because they develop later on. So when the baby starts to raise his head, this is when the cervical curvature develops. And as you stand, then, or try to walk, then the lumbar curvature starts to develop. So these are normal curvatures. Abnormal curvatures are either scoliosis, kyphosis, or lordosis. So what is scoliosis? Scoliosis is like this lady, where she has a lateral curvature. Kyphosis is different because it's an exaggeration of the thoracic curvature like that one. So normally the thoracic spine is curved or concave anteriorly. So if you exaggerate this even more, you get what's called kyphosis. Lordosis is something like usually occurs normally in pregnancy, but it can happen in different conditions as well. So normally you have a concave curvature on the lumbar spine posteriorly. So this, since the lady has an extra weight here that wants to pull her forward, she tries to put more weight posteriorly, and that's why the lumbar curvature gets more and more exaggerated. So we call this a lordosis. So we have scoliosis, lordosis, and kyphosis, and you need to know these ones very well for the exam. Now it's your time to answer some questions, and thank you for listening.